Hello, I'm going to talk about belly breathing, and I'm going to use this model to demonstrate why belly breathing can actually be detrimental to you or not detrimental to how you're breathing. So this is our thoracic cavity, our rib cage, where our lungs are. This bottom cup represents our abdominal cavity, which is bordered on the front by our abdominals, and at the bottom by our pelvic floor. We'll call it your pelvic diaphragm. For the thoracic cavity, it's bordered at the bottom by our respiratory diaphragm. So when we breathe in, air goes through our airway, expands into our thoracic cavity, gets into our lungs so we can have gas exchange. And this occurs through the contraction of the respiratory diaphragm. So when the diaphragm contracts, it lowers, and it creates a negative pressure in the thoracic cavity, which pulls air in, which allows us to expand, which allows our chest wall to pump, to go in and out. This respiratory diaphragm borders the top part of our abdominal cavity and has a direct influence on pressure gradients in here. So when this diaphragm descends, it pushes down onto our abdominal cavity and creates some distension through the abdominal wall as well as the pelvic floor. A certain amount of distension is normal. However, if you over-distend through the abdominal wall or the pelvic floor through weakness or improper training, improper breathing, you lose the elastic recoil of these tissues, which helps rebound that pressure gradient from an expansion into a contraction. It's kind of like a trampoline. Trampoline goes down, but it's the recoil of it that allows it to come back up. Same goes for your pelvic diaphragm and your abdominal wall. They're kind of like trampolines. So they allow the pressure to go back up to help that diaphragm to go into a relaxed, elevated position so one can fully exhale. You can't take a full breath in unless you've taken a full breath out. So this diaphragm has to be able to go all the way down as well as all the way up. If that doesn't happen, if there's too much distension through the abdominal wall and or the pelvic floor, this diaphragm remains in a contracted, stuck position. Now there's a direct postural influence on this diaphragm with the spine and the pelvis. The diaphragm is connected to the psoas. Those two muscles are embedded in one another. So if this diaphragm is in a constant contraction, the psoas is most likely also going to be in a contraction, and your psoas attaches to your spine as well as it influences your hips, and it creates a lot of extension. Lordosis, kind of an arch. So that can impact your posture and create an excessive amount of lordosis. But the bottom line is that if you're belly breathing and you're over distending, you're disrupting this whole process. So it's normal for a certain amount of distension to occur because those tissues have to lengthen somewhat to help with their recoil. But if you overdo it, again, you lose the upward expiration, relaxation of the diaphragm. And then you don't start to get any distension through the rib cage. So your abdominals start to turn into your respiratory diaphragm. So the abdominals start to go in and out in an attempt to pump air because the respiratory diaphragm can't do it anymore. In these types of patterns, you'll see lots of abdominal distension, but very little rib cage distension. You might also see this pattern with people that have a lot of pelvic floor weakness because the pelvic floor has dropped and it's overly distended. On the other hand, you can do this in the other extreme where you don't allow any distension to happen. Usually this is in patterns of people that are overtraining and overworking their core, and they're bracing, and sometimes they might be sucking in, and they're not allowing any of that expansion and contraction to occur through the abdominals. So generally speaking, when you inhale, your rib cage should expand, your abdominal wall should expand a little bit, but not more than your rib cage. And then on exhale, everything contracts. So hope that helps. Thanks for listening.